Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. We're going to get away from worms and germs a little while in the second half, and we're going to talk about another really important health issue, though. And skin cancer is the most common type of cancer in the United States, and melanoma is the most dangerous type. In fact, melanoma kills an estimated more than 10,000 people in the U.S. annually. Well, May is Melanoma Skin Cancer Detection and Prevention Month. And this month is used to raise awareness about skin cancer and help people take action to prevent and detect it, both at home and in the community. Well, joining me now to discuss melanoma is a board-certified dermatologist, Dr. Seth Forman. Dr. Forman is the founder of Forman Dermatology and Skin Cancer Institute right here in the Tampa Bay area. Dr. Forman, welcome to the show, sir.
Thank you, Robert.
Okay, well, let's go ahead and start out with the most basic question. And what is melanoma, and how does it compare to the other forms of skin cancer?
That is a great question. Melanoma is a skin cancer that is derived from one of the basic cells that compose the epidermis, which is the outer layer of the skin. It derives from atypical cells of the melanocytes, and that's how it gets its name, melanoma, from the atypical nature of malignant melanocytes. I know this isn't exactly what the discussion is about today. There are two other types of skin cancers that are also pretty well known and also relatively common. The next one is squamous cell carcinoma that's derived from a keratinocyte, which is also composed of the epidermis, as well as a basal cell carcinoma, which is composed of keratinocytes that are on the basilar layer of the epidermis. This is all derived from the top layer of the skin.
Sure.
But melanoma, as you said in the introduction, is certainly left unchecked the most deadly of the three.
Okay, great. Now, is there more than one form of melanoma?
Yes, there are more than one. I don't want to say necessarily there's more than one form of melanoma, but I think it's really important for your listeners and for anyone who cares about their health that while approximately 94 to 95% of all melanomas start in the skin of anywhere, by the way. It can even be the bottom of your feet, your groin, your backside, things where you wouldn't necessarily expect to be activated because these areas normally don't get much sun exposure.
Sure.
However, approximately 4% of all primary melanomas actually occur within the melanocytes in the back of the eye. So that's another place that if you feel like you're, besides the common signs and symptoms that you may know of about the skin, dark moles, things changing color, getting large, bleeding, ulceration, large size. Another secondary place that a melanoma can start is the eye. If you're getting floaters, optical symptoms, ophthalmological symptoms, that can also be a potential source of a primary melanoma. Once, and then that little 1% that we haven't accounted for, can start anywhere in the body that there's a melanocyte. Actually, they can start almost anywhere. It's rare, but it can occur.
Okay. So what are the risk factors for getting melanoma?
Well, the risk factors of melanoma, the number one risk factor is a positive family history for one of the syndromes, which are also, fortunately, relatively uncommon. The other major risk factors that you can help, because you can't help your genetics at this time, but are increased sun exposure, use of tanning beds. In men, it's most commonly on the arms, back of the neck, and the face. Women, the legs, because of frequent sun tanning, the face, and possibly even the chest and the back. So those are the main risk factors, and those are the things that we can control.
Okay. Now, is there a difference as far as gender?
There is a difference in gender. In fact, between the ages of 25 and, say, about 59, melanoma is the second most common cancer in females. And most likely it's because of the sun exposure history and possibly women potentially like to suntan or sunbathe or use tanning beds more than men. That's the theory.
Mm-hmm. All right. Well, now, so what are the signs of melanoma? What would a person see that would make them suspicious that, hey, I need to get this checked out?
Right. The primary signs and symptoms of a cutaneous or skin melanoma, this is not an eye one or one of the other rare ones, are, you can use the ABCDs, which you can usually see online, or your local dermatologist, including myself, has cards that you can take home, and so you can remember these things. So the A stands for asymmetry. If you notice a mole that's one side is nice and round and the other side is kind of jagged, that's asymmetry. The two sides are not similar. B stands for border irregularity. C stands for changes, and D stands for diameter. If the diameter is greater than 6 millimeters, then that's something that should be checked out, especially if it's enlarged within a short period of time.
Right.
So some of the other things you want to look out for, if you have a mole that was essentially nonspecific and starts to spontaneously bleed, that is a very bad sign. Nothing essentially benign spontaneously bleeds, meaning that it didn't bleed because you poked it or scraped it on a nail or slammed a hammer on your finger. If you have a mole that's spontaneously bleeding, that needs to be checked out by your doctor. If your primary care doctor is not comfortable doing skin biopsies, then you need to see a dermatologist to have a biopsy performed.
Very good. All right, so if a patient sees something suspicious like this, some kind of a skin cancer, bleeding mole or whatever, and they come see Dr. Scott or Seth Forman, what would they expect out of the visit?
What they would expect out of the visit is, especially if it's the first visit, we discuss their family history. We discuss the history of the mole itself in question that sort of triggered the appointment. And if the history and the signs and symptoms and the appearance of this lesion, if I agree with the patient that it might be malignant, then I would do what's called a skin biopsy. A skin biopsy is a relatively uncomplicated procedure where you infiltrate with some type of local anesthetic, very similar to what people get when they go to the dentist, like lidocaine or Novocaine or one of those types of anesthetics. And then we remove with a very small blade a little piece of the mole and submit it to a laboratory where it's also reviewed by a pathologist. The pathologist then interprets the slide or the specimen and will tell your doctor, the person you went to see, if it's cancer or not cancer.
All right. And so what is the course of treatment for melanoma or other skin cancers?
Well, the course of treatment for melanoma specifically is that if it's less than, say, 0.75 millimeters in depth, then just an excision with a 1 centimeter margin around the visible lesion is the indication. And that's what's indicated. It's just excision. Greater than 0.75 millimeters, some hospitals do 1 millimeter, possibly as their criteria. They will do what's called a sentinel lymph node biopsy, where they determine whether or not any of the cells have escaped from the skin to the lymphatics. That upstages the cancer to where it's more significant, and at that point you may require, in addition to skin surgery, to a lymph node dissection, possibly chemotherapy and radiation at that point.
Sure. So, as a dermatologist, someone who truly cares about treating patients with skin cancers, your best recommendations for preventive measures for melanoma and other skin cancers?
It is to prevent sun exposure, know your family history, and if you have suspicions or if you notice a mole on the back or an area where your spouse or your partner or your child or your parent can't see, please encourage them to go see their dermatologist.
Very good. Is there anything else you'd like to add that we haven't covered already, Dr. Forman?
Not at this time. I think we covered a lot about the prevention, about detection, about the initial treatment for uncomplicated melanomas, if that's even possible to say. But I think we've covered a lot.
Very good. Well, I appreciate it. Thank you, Dr. Seth Forman, for your time and expertise in this very informative interview. I appreciate it, sir.
Thank you very much.
You bet.